Welcome to Active Living at the Active Life. We're at beautiful West Point Lake on a sunny day at Holiday Park, and we are privileged to have with us today Ashton Harris from District 4 Health Services. She is an epidemiologist, and she has volunteered to sit down with us and let's talk about COVID, the vaccine, what it's like to receive the vaccine, and what new freedoms can you experience once you've been vaccinated. So thank you for being here, Ashton.
Thank you so much for having me.
Well, to start off with, for our viewers, some people may not know what an epidemiologist is. So can you tell me a little bit? I've heard the description, disease detective. But,
that's a great one.
Tell me a little bit about an epidemiologist, then we'll talk a little bit how you prepared to become an epidemiologist.
Sure. So an epidemiologist, that's a great description, a disease detective. So epidemiology reaches many different fronts, but at the center of everything, it looks at the disease in a population, different rates, and outbreaks. So obviously we're in a pandemic, so COVID is a once in a lifetime really opportunity for an epidemiologist.
Wow. Now, how did you always want to be an epidemiologist? Or I know you received your undergraduate degree from University of Georgia. Okay.
That's right.
And what was your major?
I was a biology major.
Okay. And at that point, did you know you were going to be an epidemiologist?
So I actually came in biology pre-med.
Okay.
I always thought I wanted to go into medicine. I took public health as a minor, and following my junior year, I took epidemiology as part of that minor, and I immediately fell in love. Just because, to me, the idea of helping at a population level was so much more impactful than, seeing patients one by one in an office.
Wow. And so you then went on to Mercer University for your master's.
I did.
And what was that, the master's in?
It's a master's of public health.
Okay.
Mm-hmm. Okay. Yep, and then I did several internships in epidemiology and landed at District 4 Public Health as the Ebola response planner.
Ah.
And then they kept me on because they needed another epidemiologist.
Okay, and you're furthering your education even more.
That's right.
And working on your doctorate.
I am, yes. It's a DRPH, a doctorate in public health and specifically in leadership.
Okay, and that is at Georgia Southern.
Yes, Georgia Southern.
So you spread across Georgia.
I did. I didn't really stick with one particular school.
So in being an epidemiologist, I know COVID has changed everything, but before COVID, what was your typical day like?
Right.
What would you spend your time doing?
At the local level, epidemiologists, we work with a whole bunch of diseases that are required to be followed up on by the CDC. So anything from pertussis, so whooping cough, to salmonella, hepatitis, A, B, and C, very indescript other intestinal diseases like Giardia, Campylobacter, it just goes on and on.
Mm-hmm.
But I do interviews with those patients, depending upon the disease, try to find the source of their infection, particularly if it's foodborne or waterborne. And then based on that, the interview can even go to the food establishment to see, was this a food handler that was infected?
Oh.
Was the food somehow contaminated? Or is it just improper cooking practices?
Wow, that is detective work.
It is. And we also do a lot of provider education, working with our hospitals and local doctors' offices. Of course, any outbreaks, I work with long-term care facilities, so flu season is a big one. We're always working with our nursing homes and our schools. And the norovirus is another big kind of outbreak season for us.
Okay. Well, again, those diseases did not stop with COVID.
They certainly didn't.
And so, but your plate got full with COVID. And so now, what is your main focus dealing with COVID and the vaccine?
Right. So right now, we have a really big push to vaccinate our minority groups and those who are vulnerable. So we're working toward vaccinating our migrant farm workers, minority populations, and then also vulnerable populations like those who are homebound.
Oh, and that's wonderful. We serve a large homebound population that we serve meals to, and I know District 4 is reaching out to our home delivered meal participants to actually go and vaccinate them at home.
Yes.
And that is just tremendous. That is wonderful.
Every vaccine counts. You know, the more we can get out into the community, the more people we vaccinate, the better off we're going to be dealing with the rates of COVID in the population, the
Okay.
hospitalizations, and the deaths.
And and let's talk a little bit about that. That's so important to know, because there's a lot of individuals that think, well, I'll let the other people get vaccinated, and it requires a certain level of vaccination or
That's
people
right.
with antibodies in their system to bring about that herd
Immunity.
immunity. Okay, so
Yeah,
tell
herd
us
immunity.
a little bit about that and where Georgia stands in this pursuit.
Right. So right now there is no specific level of herd immunity that CDC has recommended we need to reach to reach herd immunity and have a big impact on disease. But we're thinking it's pretty high rate, over 75%.
Okay.
And the whole purpose of herd immunity is to reach that level of vaccination or those individuals having antibodies, and just to get it to a level to prevent disease and prevent that widespread transmission. And currently we're still in a widespread rate of community transmission.
Wow. And let's talk about Georgia. What is the level of vaccination in Georgia, and how does
So-
it compare with other communities,
Yeah.
other states?
So right now, only about 20% of Georgians are fully vaccinated. About 30% of Georgians have had at least one dose, and that includes Johnson & Johnson as that one-dose vaccine. Right now, just the rates of vaccination in the community, Georgia is really low. We are towards the tail end of 50 states in our vaccination efforts, and we're trying really hard. We're pushing out vaccine, trying to increase the number of appointments at our particular public health pod sites. But there's still a lot of vaccine hesitancy in the population.
And that's strange. Georgia is so progressive in other ways and growing economically and all of
Right.
that. Why Georgia? Why is it at the tail end?
I'm not quite sure. I think there's still a lot of concerns about just the vaccine itself, the concern that it was developed so quickly, worries about safety, and just uncertainty in general. What people wanting to, the most common thing I hear is, oh, I want to wait and see.
Okay.
Unfortunately, we don't have that luxury to just sit around and wait and see, because the longer that we wait, the more opportunity there is for variants to crop up, and those variants may, affect the efficacy of that vaccine.
Wow. So are people still getting sick and going to the hospital and still dying from this disease?
Yes. So, cases have come down dramatically.
Okay.
Right now we're in a plateau in Georgia, and we've been there for a couple weeks. And so that can mean a lot of different things in the world of epidemiology. It could be positive. The vaccination, really there's not enough evidence to show that we've vaccinated enough people for it to have an effect. People could just not be getting tested.
Okay.
Or the kind of other sign epidemiologically is of that long plateau period would be a coming surge. And it's getting warmer outside, more and more people are gathering, going outside. As we get into summer, we're fully expecting an increase to happen.
So I guess the question that for our viewers is, let's summarize, what are some reasons why should somebody get vaccinated?
Yeah, so
Now again, immediately people think for my own health, but if they're for some reason are discarding that, what are other reasons that they should be vaccinated?
So besides your own health, particularly if you are older or you have an underlying health condition, you definitely want to do that for yourself. But secondly, you want to do it for your other members of the community, members who may be allergic to a vaccine component or just have some other reason why, like health-wise, why they cannot get vaccinated. And it's the same with other vaccines. That's the reason we promote vaccination in communities. The other reason is, you want to see your kids. You want to, go and be able to gather with your family and friends again. And studies are coming out that more and more we're seeing that transmission occurs in children. So it's a lot larger component than we thought, and that's why it's important for adults to get vaccinated. And right now, Pfizer is actually testing in trials the vaccine efficacy in younger children.
Excellent. So if people get vaccinated, it helps others.
It does.
Protects them. And then also our hope of returning to normacy and getting rid of these silly masks we're wearing. If more people got vaccinated, it could bring us closer to that.
It could. And then just going back really quickly to another great benefit of vaccination it brings down our hospitalizations and deaths. So right now, people are still going to the hospital with COVID, and what's really worrisome is it's starting to become those younger individuals who aren't vaccinated. So we're seeing more and more younger people end up in the hospital, and some do end up dying of COVID. And of course, we're still seeing deaths in our older populations as well.
I know, I just found out this week one of our staff members has an aunt that's in her 50s, and she is on the ventilator in the hospital. And so some people think everything's going well and forget that this battle is far from over.
It is, especially because we're worried about variants right now. Currently, Georgia is at about 46% of our cases are that B117 variant, and that variant's 20% more transmissible, and so that's why it's spreading so quickly in the state. It's kind of unknown how severe it can impact disease, so whether it makes the COVID infection worse, but it is infecting younger people, and we're seeing the results of that in our hospitalization rates.
Now let me follow up with something that you said before with if we can get vaccinated sooner rather than later, it can protect against the variations getting from being covered by the current vaccine, right? So they could have mutations that would require a whole different vaccine if we wait too long.
And so the whole premise behind that is the longer a virus circulates in a community, the more opportunity it has to mutate. So we think about it, it's just like the flu virus. We study what flu is circulating every year, and we try to get a vaccine that's going to be, as much coverage for that variant that we think is going to happen in the community. This is the same thing as with COVID. So it's mutated a couple different times, and we have 3 strains we're really concerned about, variants of concern. And like I said, we have the UK, the B117, that's pretty widespread in Georgia. We're fortunate enough that the the South African and the Brazilian variant are not widespread in Georgia. So that's very fortunate. But that's the whole purpose of getting as many people vaccinated as we can, is to prevent those more variants from occurring and possibly rendering our vaccine a little less effective.
Okay. Well, let's talk about being vaccinated.
Yeah.
Both you and I have been vaccinated.
I have.
We went through. You had 2 shots with Pfizer, and I
did.
had 2 shots with Moderna. So let's talk a little bit about how that goes about and what people need to expect, and some reactions that they can have, because I know that's a fear that some people have. And so talk a little bit about your experience and that what they need to know about when they actually get vaccinated.
Sure. So first dose, you'll have a little bit of a sore arm. You could have some flu-like symptoms, some fatigue, just general feeling cruddy. You could have some site injection soreness, some redness, and that's all very, very typical just with a normal vaccine. So that's nothing out of the ordinary. I know we kind of forget because we get a whole host of vaccines when we're young, but little kids, after they go home from their vaccine appointments, they can be fussy, they could be tired, and it's the same thing. So it's your body reacting to that vaccine, which is a good thing, because that means you're going to produce those antibodies that protect you. So it's important to know, if you do feel a little cruddy after your vaccine, that's a good thing. That's your immune system working, which is what we want.
How did you do with your 2 shots?
I did well. So the first one, it kind of felt like a little bit of a flu shot arm. That was about it for me. The second one, my arm is a lot more sore, and that's generally what we see, is that second shot you get a much more sore arm. And then I just had a little bit of fatigue for about a day or so. I did have like a little bit of chills, but I will say I was at a vaccination site in January when I had my second one, so I'm not sure how much of it was related to just being in the cold all day versus some side effects of the vaccine. But generally, the vaccine side effects are very mild. Some people will have an easier time. Some people will have a harder time. My sister actually, she had COVID and she got the Moderna vaccine, and she had a little bit of a harder time. Had a little bit more side effects.
Okay, all right. But it's worth going through that.
Oh, it's definitely worth. Right. I mean, I'd
Again,
much rather.
We're working with older adults.
Yes.
And it can be a life and death situation. And I've known at least 15 people that have died from COVID. And
Right.
that's because I work with older adults. And so it's heartbreaking. It makes me very passionate to try to encourage our older adults to go ahead, overcome those fears and get that shot, because I just don't want to see any more of our older adult population die needlessly because they've listened to something on television or a friend that knew nothing about the vaccine that scares them from being
I
vaccinated.
agree completely. These vaccines are safe. It is an emergency use authorization, but mRNA vaccines have been studied. This is not the first one. It is for human use, but we've been studying these vaccines for a long time. They show a lot of promise just in the future, not only for the efficacy of the COVID vaccines, but I was reading an article saying it could change the future of how we deliver vaccines in general, because you could have multiple components in one vaccine and just reduce the number of shots you get, especially in childhood. But it's really important because I'd much rather have just a little bit of side effects than have a really severe case of COVID and end up hospitalized, dying. And even if you do survive, we have these COVID long haulers who are really suffering with side effects.
Wow, I've met some people with that too. Respiratory issues, heart damage.
Exactly.
Those some of the residual effects of COVID. So let's talk about those that are vaccinated now.
Yeah.
What are some lifestyle change they can enjoy once they are vaccinated, especially as we target older adults?
Right.
Things they were not able to do before, things they can do now, but also some protocols they still need to keep in mind.
Sure. So one great thing is CDC came out with recommendations that if you are vaccinated, you can go and gather unmasked with the other individuals who are vaccinated. So that's a big plus. I know
Yes.
the masks are annoying and they can be burdensome. And also you can gather with one other household. So, you can see your grandchildren, other friends who may not reside with you. So that's also a big plus. But on the flip side, just because, of these variants, we don't know how things are going to look as far as breakthrough infections after you've been vaccinated. It's still important to wear that mask when you're out in public. Not only, for you, but
Yes.
for others as well.
So as you think about all the people that are unvaccinated, you possibly still could spread the disease to them because you
Potentially.
could be asymptomatic. Is that a possibility?
Right,
Do you know what the latest is on that?
The latest, we're still conducting research, and it's looking like that is not as big of a worry as it initially was, the asymptomatic transmission after vaccination.
Excellent.
But CDC has not come out with a statement yet saying yay or nay which way to go. We're still working under caution, which that's wise in the field of public health. So for right now, we still need to wear our masks, especially if you go into a crowded place. But hopefully that will also be changing in the future. COVID has been a time of continual change, and I'm looking forward to seeing what the summer will hold. Of course, we still are really pushing hard for more people to get vaccinated.
Is there any message that you would like to give to any groups of individuals to encourage them to take advantage of the vaccine? And how the last I checked, I think the vaccine is now in Troup County available all over the place. I looked on Walmart and CVS and Walgreens and the medicine cabinet, and then of course District 4 is doing.
Right.
Is that what you found? Is there a
It
surplus of vaccine available?
Yeah, we are, and it's happening all over the state too. We're just seeing a little bit of more hesitancy, and so we have vaccines, and also the state has been pushing more down, so we have more to give, which is great, because initially we were struggling with the supply. But yeah, you can go get it at your local Walgreens, your Walmart. Of course, public health, we love serving the public, so we like giving it to our community.
And you still have those going on a
We
regular
do.
basis. That's wonderful. And I've had an opportunity to witness some of those. One of those events was held at our West Point Active Life, and it was so organized and so systematic that moved people through quickly and efficiently, and that was very impressive.
Oh,
and of
thank
course,
you.
everybody was so kind, and the public safety, and the firemen were involved too,
Mm-hmm.
helping out with District 4. And it was
Yeah, we are very blessed
very
to
good event.
have great partners.
Yes. And so those individuals, if they want more information, that they just want to research a little bit more, where are some reliable sources that they could turn to find out more information, either about COVID or about the vaccine?
Sure. So, of course, they can always go to our District 4 Public Health webpage, and that's district4health.org. They can also go to Georgia Department of Public Health website. CDC is another great resource, and WHO as well.
Okay, that's excellent. So they need to rely on sites like that and be careful on the internet, because again, you can find all kind of crazy information that.
That's exactly right. Reputable
Strange
sources are
I know
the way
that
to
we
go.
can laugh about, but unfortunately some people take serious about
Yes,
chips and
chips.
all these
Yeah, I mean,
zombie type of response to the vaccine. But
Google has more tracking on you than
it would be
than
more
anything.
funny if it went lives at stake.
Exactly.
It's just sad that people would take advantage of individuals and spread those kind of terrible rumors that put people at risk.
Right. Public health, we definitely have some ways to go in fighting misinformation,
Yes.
but that's part of our job.
Well, Ashton, I want to thank you for taking time to come out here at West Point Lake and talk to our viewers about the virus and the vaccine, and thank you for your encouragement. And I hope more people in Troup County, especially older adults, will get vaccinated soon,
I do
because I
too.
don't want to see more in the hospital, more sick, and more dying.
I agree. It's been a sobering experience on all sides.
Yes, but thank you, your part.
You're
and
welcome.
being a disease detective and tracing down the source of infections, because I know that's essential to be able to determine where it came from. So hopefully we can help more people.
Okay,
So
well, I
thank you for
appreciate
that.
it. I love helping everyone.
Well, I'd like to thank our viewers for joining us again today. I hope this information has been helpful. Again, the Active Life is a recreation center for older adults. We have 3 different facilities in Troup County. We'd love for you to come and get active. We do have safety protocols of wearing masks and social distancing so we can get through this pandemic together, and hope you can come out and stay healthy, stay active, and we hope to see you soon. Thank you for joining us.